Hello, I'm Tanya Atagi, and thank you so much for joining me today to talk a little bit about facial aging and what we can be doing about this. Good or bad, facial aging is multifactorial, meaning there isn't usually one thing that causes us to look older. Very often, the best way to treat facial aging is really combination therapy. Just like with many things in medicine, you want to make the correct diagnosis and treat that particular problem. I like to look at it often in terms of layers, if you will. The surface of the skin is really what I would call that fresh coat of paint or the polish that the public sees. And so you can imagine if you have something like your home needs some freshening up, very often you'll throw on a fresh coat of paint, and regardless of whether something needs fixing or not, it just looks better with a fresh coat of paint. It's similar with your skin. You can do a lot of things on the surface of the skin or that polish, like I mentioned, in terms of improving texture, pore size, little fine wrinkles, deeper wrinkles, brown spots, red spots, discoloration, color irregularities. Those are all things that I would say can be improved upon, corrected, age reversed with treatments that really deal with the surface of the skin. And then there's sort of some of the deeper layers, if you will. If you have looseness to the skin, that's something that we can impact in terms of tightening up the skin, kind of shrink wrapping the skin, if you will. And then there's also volume. So one of the more common things that happens as we get older is we start to lose the apples in our cheeks. So you can imagine it's kind of a stuffing versus the sack scenario. So if you're losing facial volume, I feel like it really tends to age a person because you start to look more skeletal. Sometimes term it the peanut head, but if you start to lose volume in the temples, you lose the apples in your cheeks, then what happens? Well, when you lose those little pinchable apples, you're emptying out the skin envelope or the skin sac, so the skin starts to sag. And that tends to make us a little bit more jowly, heavier in the lower part of the face, more square. And so we start to lose that kind of that sweetheart or more oval shape to our faces because we're becoming heavier along the jawline. Volume restoration can help a lot with that piece of it. And unfortunately, when fillers and volumizing isn't done correctly or aesthetically, people worry about looking too chipmunky or looking chubby or fat. And so when volume restoration is done properly, it is really rejuvenating again because it's giving you more of those natural contours back to the face, more of that youthful volume. And the other thing that can happen, we kind of talked about the stuffing versus the sack. If you have extra skin, then really it can potentially be a little bit more invasive in terms of the need to remove extra skin. So I would say a very common area where we're removing extra skin is in the upper eyelids. Really, again, we're trying to match the treatment with the potential issue or problem that we're trying to correct. And so you can imagine there are different strokes for different folks as far as really we want to analyze your face and personalize your treatment to addressing what some of those points of facial aging might be for you. And certainly we want to need to take into consideration what is it that's bothering you when you get up in the morning and look in the mirror. So I would say in terms of addressing sort of that surface polish or that fresh coat of paint, everyday skincare is super important. That's really your maintenance, your everyday things, your oil changes that you're doing on a daily basis that can impact your skin a lot. Believe it or not, with just what you're putting on your face in the morning and at night, you can decrease the pigment production and even out the skin tone, get rid of some of the freckling. We can help decrease redness in your face if you tend to have rosacea or kind of those rosy cheeks all the time. There are different products that we can use to help with that. We can also increase how quickly your skin is turning over. So when we're in our 20s, our skin turns over every 28 to 30 days. So those new, yummy, healthy cells at the base of the skin layer are bubbling up to the surface, and you're shedding the old dead skin layers faster. Increasing how quickly your skin turns over, kind of turning back the clock from that perspective, can really be helpful in terms of freshening up your skin. With our skincare products, we expect them to do particular things. There are various ingredients, perhaps like kojic acid, arbutase, hydroquinone, various things that can help to decrease pigment production, and that helps to even out your skin tone, get rid of some of that freckling. And I really feel that everyone should be on some type of a retinol, tretinoin, retin A, retinol, that family of product is really anti-aging in a tube. It does many things. It can increase, again, how quickly your skin is turning over. It can down-regulate pigment production. It can increase collagen production, so it can help with some of the fine wrinkles and the surface tightening of your skin. And there are products such as that can really make your skin more youthful, turn back the time. When we talk about these products, they can often be used in conjunction with treatments. So things like regular facials or chemical peels or lasers or microneedling, radiofrequency microneedling. There are a lot of technological, less invasive, minimally invasive, more invasive treatments that we can use to do the same thing. Increase how quickly your skin is turning over, increase collagen production, kind of sandpaper your skin, if you will. So we're really smoothing out the skin surface, improving the texture of your skin, I guess similar to maybe sandpapering your skin, and many things that really, and we can oftentimes adjust the amount of downtime that you have with this. Those are different products and different technologies and treatments that we can use to really increase, improve that polish of your skin. And then when we talk a little bit more about the laxity of your skin, we can do things like laser treatments, radiofrequency energy treatments, ultrasound treatments, where the energy, oftentimes heat, will stimulate your body to make collagen. So it's kind of like having a little mini heat injury where your body says, oh my gosh, I've been injured, I have to start healing. So that's a way of increasing the collagen production in your skin. And things like radiofrequency energy or ultrasound energy is able to penetrate deeper into the skin. So we're really not just heating or warming the surface of your skin, but we're really putting energy into the deeper parts of your skin. And what that does is it helps to promote collagen production all throughout the thickness of your skin. So that's where we can get this tightening and shrink wrapping effect for your skin. Now, that's also different, and sometimes, of course, there's a little bit of a combination of having a little bit of laxity, so we can put that energy, do those treatments, increase collagen production, tighten the skin, but at the same time, maybe we have a little extra skin. And so tightening alone is not going to get rid of extra skin. So that's where the surgical procedures come in, where we're really just trimming away the extra skin. But again, combination therapy can be the most effective because if you think about it, removing, trimming, getting rid of extra skin does not improve the quality of the